is a way to help us get connected to our communities in a way that helps address the social determinants of health, or the 70% or up to 90% of our health is really determined outside of healthcare systems, outside of clinical, outside of our genetics and so on, but is really determined by some of the basics of our communities and our social lives. So in social prescribing, you might have a healthcare practitioner help connect you with community activities. Maybe it's an arts group to help you rediscover your love of painting. Maybe it's a healthy eating group and cooking group and so on. It's sort of group activities that help us address the social determinants of health, but also in a really important way address our growing knowledge that social isolation and loneliness and social exclusion or marginalization are really important determinants of health. And there's something that we can take action on in some pretty simple ways, but most of us need help to take those steps to actually do them. And so a big part of social prescribing relies on what we call self-determination. And so that really means listening to you, the person, and shifting the focus away from what's the matter with you to what matters to you. And when we think about our health and well-being in that way, the kinds of options available to us to think about what's health promoting for us, what we need to do, they shift too. And then so together we can have a conversation. In social prescribing, it would be with somebody called a community connector or a link worker, whose job it is to really just listen and help you co-design a plan of action to reconnect to the things that matter to you in a way that you both think is going to be helpful for your health and well-being.
I like that because it sounds like, everyone's different. Everyone's starting at a different place.
Yeah.
Goals are all different. And so this seems really customized to the individual.
It really is. And some of us need different amounts of help to take action on our needs as well. Some people, they might just need to be told about an activity that's happening and they can get themselves there. Lots of us, though, are going to need help. And maybe our community connector will go with us to that first swimming lesson, or will help take us out to coffee to make a connection with another human being. Because it's that familiarity and that support that helps us break through where usually we know what it is that we probably should be doing or we feel we should be doing. We want to get past the shoulds and just help us get to taking that step and doing the next thing. So self-determination has kind of four main components. They are autonomy, or our ability to decide for ourselves what we think is good for our health and well-being. And that's really important for the basics of health promotion. So health promotion is really defined as increasing our ability to make decisions for ourselves that help us take control over the conditions for our health and well-being. So that part's really important, that we decide. Competence is that we feel what we're going to do is going to be effective and that we can do it. And that's, again, where we might need some support. But there's a lot of growth and development that happens when we make an achievement, even a small step. We build that feeling of competence, and it's very good for us. Relatedness, that's the social connectedness component of social prescribing that's really important. We start to remember and recognize that we are already deeply related to one another, to the planet we live on, and to ourselves. And so focusing on our health as relational is really important. If we didn't have relationships with other people, even with the air we breathe, the food we eat, we wouldn't be alive. So remembering the relationships and building relationships is really important. And then that last one is beneficence, which means giving. There's a lot of really important research starting to show that the more we give, or the more we're able to provide some way of giving, again, even in very small ways, checking in on a friend, helping someone across the street. It doesn't have to be a massive effort, but those little moments of giving are really good for us if we're able to volunteer. And that's certainly what the research about social prescribing is showing, that people who shift from thinking about themselves as someone with deficits or someone with illnesses to someone who has not only a sense of purpose, but something to give, so a unique voice, a unique contribution to make in the world, they really, really show huge improvements in their health and well-being and their sense of self again. And those are the things that we need that will carry us through to promote some of those other healthy behaviors that we know are part of our self-care, part of our community care.